Good afternoon. My name is Adam Sorscher. I'm a family doctor in my 18th year of practice and a strong supporter of single-payer reform. In most aspects of my work, I am very happy. I've been blessed with good relationships with nurses and colleagues and patients. But there's one area in what I do that just drives me nuts. And it always comes down to the interference in patient care issues by private health insurance companies. And I just wanted to provide a very brief top 5 list of situations that exasperate me. Number 1, insurance company requests that I change my patient's medication even though they're doing well with it because it isn't on their formulary. And with many, many providers in this area, it's not uncommon to spend time changing a patient from Lipitor to Zocor and then turning around with the patient on a different insurance plan and changing them from Zocor to Lipitor. Number 2, insurance company denies payment for a test and suggests that if I want to appeal, I must call their customer helpline. The one with the recorded message that begins with 9 options to choose from. Number 3, after navigating through said recording and waiting on hold, I finally get through and am told that coverage is denied. Number 4, equally bewildering, I go through this rigmarole, and the agent, who clearly has no medical training, actually grants approval, but for no apparent reason other than that I was willing to make the call and remain on hold. And lastly, number 5, which is my current favorite, this is the letter of approval of coverage. I shouldn't complain. I get a bunch of these every week. This is a copy that is sent to me. It's actually sent to the patient. In this case, the one I'm holding, it has to do with my ordering a chest x-ray to evaluate a patient who had had a chronic cough for 6 months. And the letter they received, "Dear member, we are in receipt of a request for prior approval of the services indicated below. Our medical director has reviewed the information supplied. It is his determination that benefits," and this is emboldened, "benefits can be provided as indicated below." I see these sort of letters as largely unnecessary. And that brings me just to the point that I want to make, which is that we've heard a lot about patients who are harmed by the current chaotic system and doctors who are frustrated with it. But I believe there's one category of people who also need our help, and that is the administrator at the health insurance company who creates and sends out thousands of these letters. I support single-payer reform if for no other reason than that this would be the first step toward helping these people find a more meaningful line of work. Our system is enormously wasteful. Everyone knows that. And since resources are finite, every dollar we misdirect toward private insurance is a missed opportunity to do something good for public health. In matters as basic as healthcare, I believe that public leaders in Vermont will make smarter, fairer decisions than corporate interests. Let's get it done.